A big story this afternoon, a medical retraction decades in the making. Yesterday we learned that a top British medical journal has retracted a once landmark study linking autism to childhood vaccines, saying that it was flawed. Well, today's In Depth, we're going to take a deeper look at that admission and what it means for parents. Now, we need to make sure that you're up to date on what's happened. Now, that doctor who authored that big study on autism and vaccine is accused of paying his son's friends to give blood for the research. Now, he eventually published a paper, that was back in 1998, saying that autism was tied to measles, mumps, and rubella vaccine. The British researchers on that original study over 10 years ago may actually have their medical licenses taken away as a result of that study. Well, right now, joining me are two people who can cover all aspects of autism that we can cover in a short amount of time, which is going to be tough. Kelley Prince is a behavioral analyst. She owns and runs Behavior Consulting of Tampa Bay. Thank you so much.
Thank you.
And also a man who's no stranger to us here at Bay News 9, our Health Team 9, Dr. Stephen O'Brien. Thank you for being with us. Listen, folks, we won't have all of the answers. Do we want to get to some of them, though? Doctor, just a clinical definition of what is autism, relatively short.
Absolutely. It really has to do with problems with social functioning, language, and something that we call stereotypy, which really means repeating movements or words over and over.
Okay, Kelley, why is this subject so touchy when you talk about autism and vaccinations?
You know, I think a lot of the parents that we work with, if they feel the vaccines caused autism, you know, they said the child had the MMR vaccine, they were developing normally, and immediately following that vaccine, their child started regressing. So they started losing the language skills that they had, and then started engaging in a lot of these repetitive behaviors that the doctor mentioned.
Yeah, and cause and effect in medicine and in science in general is very difficult to prove. So why were people putting so much weight on this one particular study? Because I tried to find other studies that backed up that study.
Yeah.
I couldn't find any.
I think part of it is just a strong need to know, Al. You know, in other words, parents want to find an answer, researchers want to find an answer to why autism happens, and we still really don't know. We have some theories, we have some research that we do know it has to do with abnormal brain development, but the problem is there's different ways that that autism develops, and sometimes it seems to show itself around that time when kids are getting vaccines, but that doesn't mean that the vaccines are causing it, and the research is just not showing that.
Kelley, why are we now paying so much attention to autism when in the past, you know, for decades, we let it go?
You know, I just think the numbers are increasing. I mean, the most recent studies are showing like 1 in 93 children has a diagnosis of autism. So I think, you know, it's bringing out in the media with, you know, some of the celebrities having children with autism. So just more awareness.
Let's talk about food allergies. Some people suggest that if you change a kid's diet, that if they have autism, you'll change behavior.
Not likely. The problem that we have to keep remembering here is that this is a problem with abnormal brain development. And so if you have a brain that doesn't work properly, you're going to respond, your body and your brain are going to respond in different ways to foods. You're going to be more sensitive. But again, we're not talking causation here. The foods can't cause it.
So how difficult, Kelley, is it to make a diagnosis that, yes, this child has autism?
You know, the diagnosis is a behavioral diagnosis. So it's based on parent report and interviews and then observation of the child. So, you know, because it is a spectrum, some children are more severe than others. But, you know, there's classic symptoms of autism. And like I said, it's based on observation, parent report.
When is the earliest age that autism can be recognized?
Some parents really believe that their child is born with autism. So they don't make eye contact really early on, and they, you know, they don't ever learn to play appropriately and never gain language appropriately. But other parents then, you know, there's other situations in which children, like I said, are developing appropriately, and then around 18 months or 24 months, the child regresses.
And they are born actually with autism. It's just that we don't always see it until later. Most parents report that they see symptoms that are unusual within the first year, but some don't see it until sometime in the second year or even the third year, particularly if it's a regression issue. And there's two symptom patterns. We know they can, again, be developing normally and regress, or they can never develop normally in the first place. But autism does occur at birth. It's just it may not be evident till later.
So if you were to take a picture of the brain, can you see it?
We're getting closer. Not quite, but we are finding that some areas of the brain, at least we can see it more as they age, are overdeveloped in autistic children, while other areas of those brains are underdeveloped, and the pathways don't seem to be working appropriately.
We know that there's controversy with vaccines, period, much less being attached to autism. Are there still some kids that will have bad reactions to the MMR shot in particular?
Well, I mean, that certainly is possible, but again, we have to distinguish that from an autistic reaction. And again, I don't even like using the phrase autistic reaction because we're forgetting that brain development doesn't happen after birth. It happens before. It's starting way beforehand. Again, it's when the symptoms show themselves that confuses parents and makes them certainly understandably worried, and they go, why is this happening now? It's been happening. It's showing itself now.
Okay, Kelley, I know parents come to you on the phone. What do we do now?
Early intervention is key. So, the idea is if we can get a child in for therapy before the age of 3, even earlier if we can, that there's a lot of research to show that, early intervention is going to make a difference. So, specifically applied behavior analysis, it's got over 30 years of research to show that if we implement these programs when kids are really young, that we can make a huge difference.
What Kelley's saying is absolutely true. Early intervention is crucial because the brain is literally developing and developing. In fact, 95% of the brain is developed by age 5. So you want to get as much brain stimulation. That means these kids need lots of different types of particularly social and language stimulation early.
And lastly, should we have been more skeptical of these studies that come out and all of a sudden go, hey, this causes that?
We have to be skeptical in general, Al. I mean, studies still have their limitations, and also studies are often misinterpreted. They're often not even well run. They can be biased. We have to have a very critical eye when it comes to understanding research.
Yeah, thank you so much for stopping. I think those questions have been very, very helpful, and good luck as you continue to work with patients who have autism. Just a couple of facts and figures for you. Just last October, the CDC released some new numbers revealing that autism is more common than once thought. Officials say that now 1 in every 110 children have autism. Previously, the CDC estimated that figure at every 1 in 150. The new estimate would mean 673,000 American children have autism. Previous calculations have put that number at about 560,000. A change in how often autism is diagnosed could also account for the increase. Meantime, President Barack Obama has made autism a priority for research. Federal stimulus money has been earmarked for autism, and a 2006 law pumped millions of dollars of new federal money into autism research, screening, and treatment. Let's hope it all pays off. Well, that's today's In Depth, where we take a closer look at important stories of the day. You can head on over to baynews9.com for more information about the retraction and for medical reports related to autism and autism research.